And so I'm Dr. Terwa Yong. I'm a pediatric rheumatologist at UCLA who has essentially a L3 to L5 lumbar fusion. Status post failed L3, L4 microdiscectomy requiring lumbar fusion with severe left sciatica, quadricep weakness, and also affected my L5, so I also had a severe foot drop at that point. I was injured back in 2009, so approximately 6 to 7 years at this point. Had gait instability and actually tore out the medial meniscus in my knee as well. So also have knee instability as well as rheumatoid arthritis that goes along with my Crohn's disease, which explains the spondyloarthropathy in my back as well. Came to DBS actually through a Time magazine article written about military AFOs, and my military cousins actually contacted some people in the military, and Marmaduke's name came out, and we actually found out he was here in Carlsbad, and so my godparents brought me down here to Carlsbad, and I had actually had a thermoplastic AFO at that point. Without much result. It did get my foot off the ground. However, I had a couple of bad falls with it and ended up splitting 2 of the AFOs in half after they twisted and broke. In terms of daily functions, kind of in a week would sustain about 2 or 3 falls, kind of walking up and down on the inclines trying to get to Westwood, UCLA. Had a really hard time walking back and forwards in the ward, just even through general pediatric residency life. So was immensely frustrated, unstable gait, still requiring my crutch despite wearing the AFO. And most importantly, as a physician, you need both hands to be able to do procedures correctly. So was also looking to free up my hands to be able to do joint injections.
More wiggle. More wiggle. Yes. Yes. Very good.
In the 3 days that I have started using the dynamic bracing system, a couple of things that I actually kind of want to point out on the brace. In terms of sheer stability and engineering of the brace, once you put it on, you kind of feel the stability that it provides. The nice thing actually about this particular brace is that here in the forward fret of the brace, that goes against your shin, it provides additional knee stabilization and actually prevented my knee from collapsing as it previously did, and from having the leg give out below. The other thing you'll actually notice is the durability and the construction of this particular brace. With the thermoplastic, within 3 or 4 months, you get kind of fraying of the edges. If you ever held up a thermoplastic up to the light, if it has ever been parked in the sun by accident, you'll notice that the material will be thinning as well.
This time, I want you, when you come back, I don't want you to wiggle and stop. I want you to try to just keep moving, keep moving. Faster. Keep coming, don't stop. More wiggle to the left. Yep, good. Excellent. More. Yep.
I'm Howard Liu. I am a family physician. My wife, Terwa Yong, is here today. Well, there's been great improvements. She's able to have a gait that is actually normal. So normal in a clinical sense. In fact, I could say that as a physician, it is normal gait. So that is something very new for me. I have never seen her. Ever since I've known her, in fact, I've never seen her walk in a normal gait. And now, today, I see her walking normally. So that is very new for me.
My name is Fran Todd. I am a pediatric nurse practitioner, and I also have a doctorate in public administration. What I have witnessed here today is actually miraculous. I've known Terwa Yong since before she was injured. She came to work with us in 2009. She was vibrant and full of life and a quick step and always energetic. When she got injured, that brilliance went away. And we just didn't see it come back until Wednesday, when she was able to walk without her back brace and her cane. And all of a sudden, what changed for me the most was the expression in her face. The giggly, happy person was finally back.
Go, go, go. Yes, yes, yes. You're doing better. Yeah, excellent. More wiggle, good.
The other things you notice over the 3 days when you use the brace is that it has a dynamic propulsion system that's actually activated with the kinetics of proper walking. And the other thing is, you'll notice inside there's actually, let me just take it out, there's a split piece here that increases the dynamic portion of it as you walk against the ground. And it's split in such a way that you actually maintain foot stability, but actually you also maintain your foot flexibility as well. But you don't feel like your toes or the bottom soles of your feet are being forced into a kinetic position that it is not comfortable with. So the bottom plate of this particular brace is actually quite dynamic in terms of side-to-side motion as well. So I actually look forward to learning how to move sideways at a later date, perhaps maybe to return to the tennis courts and see what it is able to do. The other nice thing about this particular bracing system as compared to a normal AFO, and this is something you'll notice right off, is that if your foot spends much time in neurogenic de-innervation, it will actually, and you have poor dorsiflexors, your feet kind of end up on a weird angle and remain that way. And so actually as you walk, you use more and more of your outside foot, causing more stress. So as you put your foot into this, you get an immediate correction, and actually that helps kind of correct the axis within your foot and decrease the amount of pressure actually in specifically my medial compartment, which this was customized for. So immediately you notice in both your knee and your hip that there's a decrease of pressure, as well as a realignment of an ankle, which was actually essential for me. So at this point, over the 3 days, I haven't had any of the normal pains that I normally get from the duration of walking that I use. So yes, and actually if you see the superior engineering of it, you will admire it as a work of art. And it's interesting to note that it's a dynamic one piece, and if you look on the inside as well, and people don't notice this very much unless you wear an AFO or some sort of device, is that there's like no seams that actually rub you raw. And unless you've actually worn those other implements, you will really not know that. The ease of, relative ease of actually getting your foot into this, as opposed to the other laces and the other things that you have to do, I think were very striking about this. But overall, in terms of gait improvement and fatigue and stability are the main things that I have noticed over the three days that we've worked with it. I have been able to walk independently without my crutch between the guideposts, and actually stand on my left foot with it fully straightened, which I have not been able to do in 6 to 7 years, which was immensely shocking to me. And actually be able to stand up tall and proud like I did prior to my injury. The other thing that I kind of noted was the improvement in my back lordosis, which I had previously lost after my lumbar fusion.